3 mouth warning signs your health is declining, and these signs are subtle, they don't hurt, and most people ignore them. But as a dentist, I've seen what happens if they're left for too long. And your mouth doesn't just reflect local problems, it can quietly signal deeper issues in the body before showing any signs or symptoms. In this video, I'll show you 3 key warning signs to look out for. And the third sign is something 90% of people miss, but when it shows up, the damage has already started. But first, let's start with one of the earliest and most dangerously misunderstood warning sign your body gives you: bleeding gums. And let me be absolutely clear, healthy gums do not bleed. Not from normal brushing, not from proper flossing, not from anything. What's happening when your gums bleed is fundamentally different from a cut. So this isn't mechanical damage, it's your immune system actively responding to chronic bacterial stress. It's inflammation, and that's a critical distinction. Here's what modern research has confirmed. Inflamed gum tissue isn't a closed system. These inflamed tissues become more permeable, allowing inflammatory compounds and even bacteria to leak directly into your bloodstream. And that can create a cascade of effects throughout your body. So it can raise systemic inflammation markers, it can place stress on your cardiovascular system, it can worsen insulin resistance and metabolic health, and it can trigger immune responses far from your mouth. Your gums are absolutely packed with tiny blood vessels, some of the densest vascularization in your body, and when they're inflamed, they become a direct superhighway from your mouth bacteria straight into your circulatory system. And I've seen this countless of times. Patients who brush twice a day, occasionally floss, and think they're doing everything right, and they still have bleeding gums. And that's because this isn't just about technique, it's about your oral microbiome balance, it's about the overall inflammatory status, your diet and nutritional balance and status, and also your immune system function. So what can you do if you're seeing blood in the sink? Here's my comprehensive approach. First thing is the basics. So switch to a soft bristle toothbrush. Firm brushes can actually damage the gum tissue. Use gentle, small circular motions rather than aggressive back and forth scrubbing. And avoid alcohol-based mouthwash, which disrupt the beneficial oral bacteria and dry out the oral tissues. And next thing is to upgrade your interdental cleaning. So what I mean here is if your gums have started to recede even slightly, use an interdental brush because that can be more effective than a floss. Consider using a water flosser for deeper cleaning between your teeth and below the gum line, and clean in between your teeth before brushing, because then this allows the toothpaste to reach. The second warning sign is literally hiding in plain sight, yet most people never even think to check it, and that's the surface of your tongue. So when I examine a patient, one of the first things I look at is their tongue, because before the teeth or the gums show any problems, the tongue has already been signaling distress for months or even years. So take a moment right now, stick out your tongue and look in a mirror. What do you see? Is it healthy pink with a minimal coating? Or do you notice a whitish, yellowish, or grayish film covering parts of your tongue, especially towards the back? That coating isn't just leftover food or something benign. It's what we call a biofilm, a complex ecosystem of bacteria that cells, food residue, metabolic waste, and even sometimes yeast, all trapped in the tiny crevices and papilla that cover your tongue's surface. Now here's what most people don't realize. The biofilm isn't just sitting there passively, it's metabolically active. So it's constantly producing compounds that affect your entire oral environment. And these bacteria are producing volatile sulfur compounds that cause halitosis or bad breath. They're creating acids that damage the enamel. They generate endotoxins that irritate tissues. And this is crucial, they're also being continuously swallowed, seeding your gut with microbes that may disrupt your digestive health. And the research on this is fascinating because multiple studies have now confirmed links between tongue coating and imbalances in the gut microbiome, altered digestive function and discomfort, in slower recovery from various illnesses, and reduced taste perception, which can actually drive food cravings and overeating, and even correlations with certain inflammatory conditions. Now, Eastern medicine understood this centuries ago. Traditional Chinese medicine used tongue diagnosis as a central assessment tool, and Western research is finally catching up, confirming that tongue appearance doesn't just reflect oral hygiene, it's actually a window to systemic health, to things including like digestive function, immune status, hydration levels, detoxification capacity, and even stress and sleep quality. So what's the solution? It's remarkably simple, yet most people never do it, and that's proper tongue cleaning. So I'd recommend using a dedicated tongue scraper. Stainless steel or copper works best. First thing in the morning, before eating or drinking. Stick out your tongue comfortably, then place the scraper to the back of your tongue as comfortable as possible, and then pull forward gently with firm pressure. And then rinse the scraper 3 to 5 times, and then finish by rinsing your mouth thoroughly. Here's a few key points about this technique. So warning is crucial when the biofilm is the thickest after hours of reduced saliva during sleep, and be gentle but thorough. So you shouldn't cause any pain or bleeding, and don't use your toothbrush for this because it's not designed for this task, and it often just ends up redistributing the biofilm rather than actually removing it. And consistency here matters more than intensity. So daily gentle scraping is far better than aggressive weekly cleaning. Now, what kind of results are we expecting here? So many people report noticeable differences within just 3 to 5 days. Significantly fresher breath, especially in the morning, reduced fuzzy mouth feeling upon waking, and an enhanced taste perception, foods that taste more vibrant, and even some reported a reduction in sugar cravings and mindless snacking. And I'd also recommend following tongue scraper with a xylitol-based rinse to further inhibit bacterial growth, or simply just warm water with a pinch of high-quality sea salt to restore the oral pH, and also make sure you stay hydrated throughout the day to maintain the optimal saliva production. Now let's talk about the third warning sign, the one that over 90% of people completely miss or dismiss, yet it could be the most destructive of all, and that's a chronic dry mouth. So think about this. Do you wake up with a dry mouth? Do you find yourself constantly needing to sip water just to feel comfortable? Or does your mouth feel sticky or tacky by late afternoon? Or do you struggle to eat dry foods without a drink? So if you answered yes to any of these, you might be experiencing what we call xerostomia, and that's a clinical term for insufficient saliva production, and it's far more serious than what most people realize. Now, your saliva isn't just water. It's actually a remarkable biological fluid that contains antimicrobial compounds that keep harmful bacteria in check, buffering agents that neutralize acids from food and bacterial metabolism, and minerals that actively remineralize your tooth enamel. Now, when you lose adequate saliva, everything in your mouth changes, and not for the better. So you start getting cavity-causing bacteria that multiply exponentially without the controlling factors in saliva. Your oral pH drops dramatically, accelerating enamel erosion. Your gum tissues become more irritated and more vulnerable to infection. You'd also have food particles that stick on your teeth longer, feeding the harmful bacteria, and your microbiome also shifts dramatically towards the disease-causing species. But dry mouth isn't just about oral health, so it could be a warning sign of chronic stress and anxiety, and especially in the sympathetic nervous system, or even medication side effects. So over 500 common medications can actually reduce saliva flow, or even hormonal imbalances, particularly during menopause or autoimmune conditions in early stages. And here's a simple test you can do at home. So place your finger right against the inside of your cheek and drag it forward, and it should glide smoothly with no resistance. If it feels sticky or grabs, your saliva production may be compromised. And here's another indicator. So if you wake up regularly in the middle of the night needing water, or your lips stick to your teeth in the morning, these are clear signs that there's inadequate saliva flow. And the long-term consequences of chronic dry mouth are severe, and that includes rampant tooth decay, often at the gum line where it's hardest to restore, accelerated gum recession and attachment loss, or even persistent bad breath that doesn't respond to traditional remedies, increased risk of oral yeast infections, difficulty with speaking, chewing, or swallowing, and even changes to taste perception and enjoyment of food. So what can we do if we're experiencing a dry mouth? Now, first, let's address the basics, and that means hydrating constantly throughout the day. Small sips are better than occasional large amounts, and avoid mouth breathing, especially during sleep. And consider nasal breathing exercises or even mouth taping under proper guidance, or even reduce your caffeine intake or alcohol consumption, which can both be dehydrating, and use a humidifier in your bedroom, especially during the winter months. And for immediate relief, what I'd suggest is to chew on xylitol gum or suck on xylitol mints after meals to stimulate the saliva production and to protect your teeth. Now, if you notice that white coating on your tongue, which I mentioned earlier, or any of the unusual tongue appearance, you need to watch my next video and what your tongue says about your health. And I'll show you exactly how your tongue reveals hidden nutritional deficiencies, stress levels, and digestive issues you may not even realize you have.